Hello, my name's Tina McDonald. Thank you for joining me today. Today's counselling conversation is going to be around CFT. I use sections of it because I believe it's a helpful tool to use in a counselling room because it reminds us of the importance of focusing compassion. CFT is compassion focused therapy. It's a meeting of CBT, which we talked about before, about replacing brain patterns, and Buddhist philosophy about the importance of kindness, and also the neuroscience of how good compassion in your life is for you. And it was Dr Paul Gilbert. So it's especially helpful for those people who have a really high level of negative self-vision. So low self-esteem, problems with body image, shame, anger, depression, anxiety, and where they all come from and how we work with them with ourselves. So the importance of starting with compassion is really the crux of what this theory is. It's the importance of working with compassion for self. By looking at where and separating it from the anxiety, the depression, to the external, so that's the world and the power that others have around you, and what coping strategy is attached when those two meet. Internally, anxiety; externally, somebody you know, places you have to go, an event. Those two together, where is your coping strategy? And is your starting point for all of that is to approach it with compassion for you. So the range of techniques that are involved with CFT are soothing, breathing, rhythm. So that's about, again, filling your body with breath. As we know, everything for me comes back to the breathing and the grounding, because that is connecting you to now, to the present. About positive affirmations, as we've talked before. I think in the NLP, the neuro-linguistic programming, when we talked about that, the importance of positive affirmations, you know, that fake it till you make it thing, that actually they really work, and scientifically it's been proven that they do. So engaging with others and engaging with challenges, but engaging in the positive way. It's about actually finding that small, tiny moment of positive in a situation, and that's your point of contact. Engaging with things positively in your emotional resources. So you have a store together with myself in a counselling setting, that we look at these things, you know, as a standalone technique to work with. Where is the emotional positive content, and how can you access it? And what's our starting point of looking at it? And that realising that things that happen are not your fault. There doesn't have to be an attachment of blame, shame, guilt. Sometimes even massive things can still always be brought back to, well, it was me, I should have, I shouldn't have. And by approaching things from a compassionate stand, it lets you understand that, no, it didn't matter what you did. It wasn't your fault, full stop. And that's okay. And so it's looking at the compassionate voice for yourself, but really believing it. And I think that's where CFT comes in its own, in that it helps you to encourage yourself to be kind to yourself from a compassionate point of view, and that it's okay for you to be compassionate to you and not always be looking for others to give them the compassion. Oh, I have to help, I have to do. Maybe sometimes it's okay for it to all be about you. So CFT, I believe that it can support CBT, that thing that we talked about, you know, reframing the brain using positive emotional energy. And so the three things that CFT kind of is based on is one, learning about human nature. It's very important. That's you too. Two, learning skills to develop that there are different giving systems and that you can look at things from your point of view in a different way. So it's practicing activating caregiving to yourself, and it's on a daily basis. Every day, positive affirmations in the morning, every day looking for that emotional content that's compassionate and positive. So the way that we work is we've got the 3 brains. So we've got the drive, which is the striving. CFT helps you look at that as positive focus for goals in a caring way, not a striving way. And then your threat system, so as we talked right at the beginning of the pandemic about the fight, flight, freeze, it's about that. This is all feeding anger and anxiety, and it's feeling less threatened. It's helping you to feel less threatened because you're then engaging soothing. So it's about open attention, digesting, finding the best that you can for you from a positive standpoint. On a personal level, as a pluralistic counsellor, I have the joy of always being able to look at further learning, and this is an area that I would be interested moving along to be able to be fully trained as a practitioner in CFT, so I could do standalone rather than just using parts of it as I do now, because I find it's a very helpful and it's a very kind way of working with yourself. So that was our whistle-stop tour of CFT, Compassion Focused Therapy. I hope it was of interest, not a recommendation, but just to let you know that it's out there, and that as a pluralistic counsellor, if we work together, this again is something that I'm possibly pull different bits and pieces from, depending on the situation and depending on the client's wants and needs. But so yes, CFT. Hope it was of interest. As always, please subscribe, leave some comments, and take care. Thanks very much for your time. Bye-bye.